Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73600 Radiologic Examination Ankle, 2 views. This code includes an AP and lateral image or any 2 ankle views, and 73610 Radiologic Examination of the Ankle, complete, minimum of 3 views. This includes a more complete study of the ankle joint with 3 or more views. Ankle radiographs include both standard and specialty views designed to visualize trauma, arthritis, or instability. Coders must count and identify views for proper CPT selection. Standard views, AP view, lateral view, medial oblique view, mortise oblique view. Trauma views include cross-table lateral, AP stress view, or gravity stress view. Stability and arthritic evaluation views AP weight-bearing view, mortise weight-bearing view, lateral weight-bearing view. Each view helps highlight critical anatomy such as the talus, medial and lateral malleolus, and posterior malleolus. Report example, order exam, ankle 2 views, left header, AP and lateral views of the left ankle. History, injury. Comparison, 7/28/2022 radiographs and CT from 1/31/2022. Findings, interval healing of distal tibial ORIF with cement augmentation, no interval hardware complication. Interval healing of posterior talar and calcaneal fractures. Ankle alignment is unchanged. Multiple retained metallic foreign bodies noted. Impression, interval healing of left ankle fractures. Let's look at the views. AP and lateral views, that's a total of 2 views. This qualifies for CPT code 73600 left radiologic examination ankle. 2 views left. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, the radiology report documents interval healing of 2 distinct fractures. Posterior talar fracture, calcaneal fracture. These fractures are healing, and this exam is a subsequent encounter. Therefore, the 7th character D should be used to reflect routine healing. The most appropriate ICD-10 CM codes are S, 92.014D, non-displaced posterior process fracture of the left talus, subsequent encounter for fracture with routine healing. Use this when the report specifies a posterior talus fracture on the left side and healing without complication. S 92.002D, unspecified fracture of the calcaneus, left foot, subsequent encounter for fracture with routine healing. Used when the documentation doesn't specify displaced versus non-displaced, but confirms a healing left calcaneus fracture. The correct codes for this report are 73600 left radiologic examination ankle, 2 views left, S 92.014D, non-displaced posterior process fracture of the left talus, subsequent encounter for fracture with routine healing, and S 92.002D, unspecified fracture of the calcaneus left foot, subsequent encounter for fracture with routine healing. Report example, exam left ankle gravity stress view. History, ankle sprain, concern for syndesmotic injury. Comparison, none. Findings, the gravity stress view reveals a dynamic widening of the tibiofibular space. Impression, deltoid ligament injury. This exam includes 1 gravity-assisted stress view with no provider force. This qualifies for CPT code 73600 with modifier 52, reduced service. This approach is often used in orthopedics when clinical suspicion is high, but no manual stress is applied. Modifier 52 indicates a single view was performed instead of the standard 2. Report findings state, a widening of the tibiofibular space resulting in a deltoid ligament injury. The most appropriate ICD-10 CM code is S 93.422A, sprain of the deltoid ligament of the left ankle, initial encounter. The correct codes for this exam are 73600 radiologic examination ankle, 2 views, left with modifier 52 for reduced service, and S 93.422A, sprain of the deltoid ligament of the left ankle, initial encounter. Report example, order ankle 3 views, right header, AP, lateral, and oblique views of the right ankle. History, ortho follow-up. Comparison, 1/8/2023. Findings, lateral plate and screws cross a distal fibular fracture. Additional threaded screws fixate a medial malleolus fracture. Hardware is intact. Alignment is near anatomic. Impression, unchanged alignment of bimalleolar ORIF. Let's look at the views. AP, lateral, and oblique. That's a total of 3 views. This qualifies for CPT code 736, right? Radiologic examination of the ankle. Complete, minimum of 3 views. Right? Report findings state. This is a follow-up exam for a bimalleolar fracture after ORIF. The patient is receiving routine orthopedic follow-up, and the fracture is healing without complication. ORIF is intact, and alignment is stable. The most appropriate ICD-10 CM code is S82.841D. Displaced bimalleolar fracture of right lower leg, subsequent encounter for closed fracture with routine healing. The correct codes for this report are 73610, right, radiologic examination, ankle, complete, minimum of 3 views, right, and S82.841D, displaced bimalleolar fracture of right lower leg, subsequent encounter for closed fracture with routine healing. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the Medical Association AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.